Okay, I think we'll go ahead and get started. You all are muted and off screen. And so when Angie starts, you might have some questions you'd like to put in the chat. So feel free to do that at any time, and we'll do the question and answers at the end. I think we are recording this, and so it'll be put on our YouTube channel, and you can look at it later or tell your friends about it. We're really pleased to have Angie Dillon-Shore here today. Angie has nearly 40 years of experience in the fields of human services and public education and possesses a master's degree in both counseling, psychology, and special education. She began her career as a K-3 special education teacher, both in rural Lake County and urban Oakland, and then in the mid-90s pivoted her focus to community-based services addressing interpersonal violence and high-risk youth. Prior to her current role, Angie served for 5 years as the Director of Healthy Communities Programs for Community Action Partnership, followed by a stint at Sonoma County Human Services, managing the Board of Supervisors Upstream Investments Policy Initiative, which was really a fascinating initiative that we went through for many years. In 2016, she transitioned to the role of Executive Director of First Five Sonoma County, where she continues to guide strategic, equity-centered public investments in programs, systems improvement, and policy change that promote thriving families and healthy child development. Her vision and persistent efforts to ensure First Five's sustainability and deepen impact were instrumental in achieving successful voter approval of Sonoma County Measure I in 2024. This is why it's important to the league. We believe in transparency, and so we always want to assure the voters that the taxes that they approve through this process is being well spent. So we're really pleased that you're here today, Angie. Angie lives in Guerneville, as do I, with her wife Nancy and 3 French bulldogs. In her free time, she loves traveling and experiencing live music. So we're really pleased that she's here today, and we'll have you talk for 30, 40 minutes, and then we'll take questions at the end.
Great. Thank you so much, Donna. Let me share my slides. Can everybody see those? All right. So, so today I'm going to talk with you guys about Measure I, Sonoma County Measure I, the Sonoma County Childcare and Children's Health Initiative. It was a ballot measure. Now it is an ordinance. And I'm going to kind of back up first and talk a little bit about why we got here. So a discussion about establishing a local dedicated revenue stream for kids has been going on really since 2015, maybe even a year or two before that, and really started getting some traction around 2022. The driving factor for the conversation was the historically and perpetually inadequate investment of state and federal dollars to support optimal child development. But we really saw the impact to our child care system, as well as the mental health needs of children, spike as a result of the 2017 wildfires. And then, of course, on top of that, the pandemic a few years later. So a bad situation got even worse. The decision to move forward with the ballot measure was very well supported by data. First Five had administered a kindergarten readiness screening for 7 years at that point, which found steadily declining year after year readiness of entering kindergarten students, not just academic readiness, but also social emotional readiness. Overall, only 1 of 5 entering kindergarten students scored as ready to succeed on a standardized tool. And not only was school readiness declining overall among 5-year-olds, but every year we also saw a widening racial disparity. We lost over 500 childcare slots overnight in the Tubbs fire. And then since 2019, Sonoma County has lost thousands more slots. Our childcare system continues to experience severe challenges with recruiting and retaining workforce due to low wages, the high costs to provide care that results in a lack of affordability for families, low state and federal reimbursement rates for the operation of subsidized programs, and aging facilities and the cost of maintaining facilities. This is exacerbated with the escalating cost of housing for our childcare and early learning workforce, and this just the stress of caring for children who are coming to care with increased behavioral and social emotional needs. So Measure I was approved by voters countywide in November 2024 at 62.8% of the voters, 1/4% countywide sales tax, and estimated at that time and proving to yield at about 32 million in annual revenue. The campaign had really broad support and endorsement across every sector of the community. Notably, the business community was quite supportive of the measure, recognizing the critical importance of childcare so that their employees could come to work. This was really elevated and highlighted during the pandemic. There was no organized opposition to Measure I, which is unprecedented, as I'm sure you all know, for a sales tax measure. Even the Sonoma County Taxpayers Association agreed to not oppose because they recognized the economic imperative. Measure I was a voter-led initiative, meaning that it had to qualify for the ballot through a signature gathering process. Voter-led initiatives are also only held to a simple majority threshold, so 50% plus one vote, versus 2/3 threshold if the Board of Supervisors were to have put it on the ballot. So this was really key because we had done polling over the years and just were really challenged to be confident in being able to reach a 2/3 threshold. So when the legal precedent was established for a voter-led initiative, that's when it really started to be quite feasible to pass it. First Five Sonoma is named as the administrator of the Measure I tax revenue. I'll say more about that in a couple of slides. And also, very importantly, there is no sunset for Measure I. The tax is in perpetuity or until a measure were to be put on the ballot and passed that explicitly would end the tax. Measure I ordinance directs after administrative costs to collect and administer the funding, 60% to the expansion and of access to early care and education, and 40% to children's health and mental health. On that ECE side, the early care and education side, the ordinance calls out investments in the child care workforce, particularly wages, facilities, childcare facilities, family scholarships, amongst other systems investments. And on the health side, the focus is on system improvements that will increase access to perinatal and early childhood mental health screening and treatment, pediatric screening, referrals, and I'll talk more about really specific strategies in a few minutes when we get to the actual strategic plan. Also important to note that the measure specifically prioritizes low and middle income families for all of the strategies and children who are impacted by homelessness, housing instability, and other traumas. Oops. As I said, First Five Sonoma is an independent public agency and was named as the public administrator for Measure I. This is primarily due to the Commission's 27-year history administering the state ballot measure Prop 10 revenue stream, which is a tax on tobacco products that was approved by California voters in 1998. That tax is administered by 58 county-level commissions across the state, along with a state commission. The tax revenue has significantly declined over the years, which was the intention. Here are the 4 statutory goals of Proposition 10, and you can see that it is quite closely aligned with Measure I. Prop 10 dollars continue to be invested locally by First Five to promote comprehensive health and development of children birth to five, diverse and high quality and early learning environments, nurturing parenting and caregiving, as well as ensuring that systems are integrated and coordinated. In terms of that revenue, Sonoma County initially got about 12 million annually, so starting in 1999, and then declined over time because of the declining purchase of tobacco products. And it is down to about 3 million annually in the last few years, expected to get down below 2 million and plateau at some point below there. So you can see that the Measure I funding at this point really dwarfs the Prop 10 funding that we're administering. The measure not only named First Five as the administrator, but it says that we are to integrate the planning and the administration of Measure I with our existing strategic planning and grant-making infrastructure, which we already had in place for Prop 10. We plan allocations of funding in 5-year cycles and it's all driven by a 5-year strategic plan. Although First Five Sonoma is an independent entity, we did separate from the County of Sonoma in 2019. The Board of Supervisors, as per state statute, does appoint the First Five commissioners. There's a commission of 9 commissioners. The board also appoints, as per the Measure I ordinance, an 11-member community advisory council that meets regularly to craft recommendations for strategic investments as per the Measure I ordinance. And then those recommendations are brought to the commission, which then they get integrated into our strategic plan. That Community Advisory Council, also known as the CAC, is combined of childcare, early education, and health professionals, as well as parents. There are childcare providers on there, both family childcare and center-based childcare. One of our resource and referral organizations is represented. And then the health seats are from all over. There's a pediatrician, there's someone who works at county public health. So a diverse set of folks that care about children's health. The commission is also advised by what we call our Leadership Advisory Roundtable and many other stakeholders throughout the community, and you can see those listed there. So the measure was passed in November 2024, and the tax was initiated, the collection was started in early 2025. First Five Sonoma County spent last year scaling our infrastructure, gathering lots of data, gathering input from stakeholders, conducting a very, very complex and detailed planning process. But given that the Measure I funds were coming in and the urgency of needs in the community are very prescient, the CAC, the First Five staff, and the commission went forward, decided and went forward with making some of the investments prior to the 5-year plan being approved. Most of these, what we called early investment funds, are already in the hands of the community and services are currently being delivered. So of that, about $500,000 in mini grants to licensed family child care providers has been distributed. $3 million in child care facilities funding is in process, and that's really focusing on just emergency needs. So places where mold is making it, just an unsafe environment for kids to be in. We're also conducting a countywide child care facilities needs assessment in partnership with Low Income Investment Fund to look very deeply at geographic need, demand, so that we can precisely target that facilities funding over the coming 5 years. A model to increase the compensation of childcare providers is under development through a partnership with UC Berkeley's Center for the Study of Childcare Employment. This is a really complex and nuanced endeavor. We want to get it right. In the meantime, an incentive payment will go out in the next month or so to childcare providers while that compensation model for the long term is developed. We're also partnering with the junior college, SRJC, to support 10 ECE apprenticeship sites. Those are already happening. They're paid apprenticeship sites through the program at the JC. We've made grants to 8 different organizations to provide perinatal support groups across the county. We've expanded graduate scholarships and paid clinical apprenticeships for MFT and LCSW students that want to work with young children and people in the perinatal period. That's happening through the Healthcare Foundation of Northern Sonoma County, as well as Humanidad Therapy. And then we've also made several grants to community-based organizations, I think it's Catholic Charities and COTS, to address the needs of unhoused families with young children. So here's our strategic plan, 2026 to 2031. It's a 5-year plan that the commission and then the Board of Supervisors approved in December, which again integrates Measure I funding with Prop 10 funding. We're currently implementing a grant-making process for the new strategic plan. It's about 30 to 32 million a year for the next 5 years. So this grant-making process is, it's a pretty big lift compared to the grant-making that we've been doing for over 20 years. There are 4 primary areas in the strategic plan. 2 of them are primarily funded by Measure I, and the other 2 are primarily funded through Prop 10. So these are the 4 goal areas. The first one is healthy children. Children's physical, emotional, and developmental needs are met starting in the perinatal period to promote a healthy start in life. Thriving families. Families of young children have their basic needs met. They experience safety and connection to the community and support systems and are resourced as advocates for their children. And the third is the biggest area, early care and education. And the goal is that our ECE system is well resourced with a supported and stable workforce to ensure equitable, high quality early learning that meets families' needs and prepares children for success in transitional kindergarten and beyond. And then the last area, community as champions. Community members and leaders across the county's public, private, and nonprofit sectors are champions and change agents for young children and their families. So here's the big allocation buckets of funding for each one of these areas, and I'll say a little bit about the strategies that are built out. We can, kind of go deeper and deeper into the detail, but I'll keep it at a fairly high level. So that first area, healthy children, over the 5 years, at this point, we allocated 60 million. And this is after administrative cost. So some of the kind of more targeted strategies are expanding access, in particularly to culturally responsive health services for very young children and parents. So doing that through supporting mobile clinics and pop-up clinics, doula care, community health workers, and really in particular centering marginalized families and kids to ensure a strong start early in life. We'll be continuing those investments that we started in the early investments to expand the clinical workforce through scholarships and internships. I'm doing some continued very robust funding to expand screening for perinatal mood disorder, ensuring that support for this is accessible and that it's culturally responsive. In the area of thriving families, and it's a lot less funding because it's really primarily funded through Prop 10 at this point. We will continue to fund family resource centers. That's something that we've done for a while, and strengthening the network of those neighborhood hubs that provide a lot of support to families to navigate systems. They make referrals, they help link families not only to basic needs like food and diapers, transportation, but also to make sure that they're having access to safety net programs like CalFresh and Medi-Cal. We'll continue to support the countywide Triple P training for the county and community-based organization providers. That's the Positive Parenting Program. Also continuing our investments in Know Your Rights and family preparedness planning, linkage to immigration legal services. This is primarily done through our Family Resource Center network and organizations like VITAS and Sonoma County Legal Aid. And then we'll have a new focus starting with the strategic plan on supporting efforts to build parent advocacy muscle and their political voice. We really found in the campaign part of Measure I that we don't have a very strong or organized parent political voice here in Sonoma County. And so we would like to, start with some parent leadership programming through our community-based organizations. So you'll see that next year. The third area, again, the biggest area, 80 million over 5 years. As noted, we're developing this compensation model to increase compensation, wages, and potentially other aspects of compensation for childcare providers. We hope to deploy that sometime in late 2026, and there'll also be rolling grant opportunities to address childcare facility needs. We'll continue to support the ECE apprenticeship program. That'll be a big priority. We need to increase the compensation of providers in the field and then continue to build that pipeline for our workforce. The state funding for what's called Quality Counts, it's coaching and professional development for childcare providers. That's going to end in the next year. So at some point, we will use Measure I to ensure that that work is sustained. It's been really critical to increasing the quality of our childcare and early learning settings across the county. And then, of course, ongoing support for the Dolly Parton Imagination Library. Our goal is that we reach every child from birth to their 5th birthday to sign up to receive a free book in the mail every month. Current childcare subsidies in our county are not enough to meet the need. And so there are funds in this strategic area that are allocated to expand childcare scholarships for working families who are not eligible or who might be eligible but are on a wait list. We're also developing a methodology for making bridge loans to providers to ensure stability during times of delayed state and federal payments and other factors like disasters. And then continuing the small grants, our mini grant program for childcare providers to purchase supplies, equipment, and just really enhance the quality of their environments. And then the last area, community as champions. These are investments that don't fit neatly in any of the other buckets. We'll continue our partnership with the Metro Chamber. They do some amazing work engaging employers in family-friendly workforce policy. And then we'll also continue our support of advocacy to ensure greater access to affordable housing. If you haven't seen already, you will start seeing it soon, a fairly robust communication campaign for First Five in Measure I that'll include signs on buses, billboards. I think there's 3 or 4 billboards on 101 already. There'll be grocery cart ads and radio ads, so keep an eye and ear out for those. And then we also do sponsorships for community events and special projects, as well as we have an allocation for stipends for community engagement. When we engage community members in helping us plan and helping us design programs based on their lived experience, we always make sure to compensate them for their time. And so there is an allocation in this goal area to support that. So at this point, I will pause to answer some questions.
Thank you, Angie. That's a lot of information. I'm glad to see you've got a campaign scheduled for the community to know, how the money's being spent. I'm in the field, so I know a lot about what you've been doing.
Yep.
But it's great that I think a lot of taxpayers and voters don't always know how the money's being spent. So we love to see that. We have a few questions. How do eligible families find out about all these great services?
So we really rely on our community-based partners. Right now, I think we have about 25 funded partners, and then over the next year, so that'll expand to probably 30 to 35 community-based partners, the ones who work day to day on the ground with children and families. I mean, we have, our social media efforts. We have a website. We do have a parent resource guide that we distribute to all of our community partners, but we rely on our community-based partners because they're the trusted messengers, and also those family resource centers, right, that help families figure out what it is they're eligible for and how they can meet their needs. They're the experts on all of the different needs in the community.
Could you explain more about the partnership with the Berkeley Center for Childcare Development? What would they provide?
Sure. So the Center for the Study of Childcare Employment at UC Berkeley has done work throughout the state at a state level and also at a county level. They helped us actually understand at a pretty deep level the all the different aspects of childcare provider compensation, not just wages, but benefits, time off, how they can or can't access substitutes. So they have tons of data. They're researchers at heart, and that's their expertise. And so we're partnering with them to help us design a compensation model. So making sure that when we do start pushing out funding on a regular basis to childcare providers, what are that we're avoiding unintended consequences. For example, childcare providers currently, the vast majority of them make fairly low wages. Many are eligible for public benefits. So we don't want to push out funding in a way that would inadvertently make people ineligible for public benefits that they actually need. We want to find ways to make sure that people are opting in and that they understand the implications of accepting, any kind of wage boost. So there's that, and then there's a lot of other equity issues, right? The ages of providers, how long they've been in the field. Lots of different organizations provide childcare and early learning services, right? So there's a landscape of what we call the mixed delivery system. There's center-based programs that are operated through nonprofits. There's family childcare providers that are basically small businesses. And so that model needs to be really nuanced so that it's meeting all the different needs of those individuals and how they experience their revenue for what they're providing, right? Are they getting a paycheck from an organization, or are they getting a check from a family to pay them for the next 2 weeks for childcare for their child? So we're working with Berkeley to help us figure out all of those kind of little mechanisms in order to push those funds out in a cost-effective way and equitable way.
At one point, our PhD nurses would make home visits to low-income moms after they gave birth. Is that still happening? And if not, is that something that would be worth funding?
Yeah, our public health nurses at Department of Health Services in the Nurse Family Partnership Program, First Five has not been funding that for the last, say, 4 or 5 years. That's something that Measure I funding is absolutely could help to fund to scale that program. There are other home visiting programs in addition to the public health nursing program. Nurse Family Partnership is an amazing program. It's a evidence-based program, the kind of the gold standard of home visiting programs. But there's a lot of moms out there that would prefer to have someone that really reflects their culture, is perhaps seen as a peer. So we want to also fund a range of home visiting programs that include that kind of peer level, grassroots level. Last year, we piloted a program called Acorns to Oak Trees, which is a home visiting program by basically CHW level folks that are also members of the tribal community, and they go and work with Indigenous families around the needs of moms and new babies, doing developmental screenings, identifying where there might be developmental concerns. So that's an example of kind of a more diversified way of addressing home visiting.
I'm concerned that so many children enter kindergarten underprepared. What are some of the gaps and how are you addressing them?
Mm. Yes, it's really complex. All the different factors that impact school readiness, right? There's absolutely early learning, high quality early learning experience matters. Preschool matters. Going to a childcare that's has some language rich focus that matters. That helps to prepare children for kindergarten. But what we find are some of the most negative impacts on child development are poverty, parental stress, lack of access to resources early on. And so it's those more kind of environmental, social determinants of health that we're most concerned about. That's why we fund things like advocacy to increase access to affordable housing. We're also this year going to expand that to include a focus on tenant rights and eviction prevention. We know that trauma impacts early learning and then eventually school readiness. What we did see in those screenings over the years is, yes, there's definitely an impact on kids not knowing their letters or colors or shapes, right? These sort of pre-academic skills. But what we also saw as kids coming to kindergarten with a lack of ability to regulate their emotions, to follow simple directions, to have an interaction with another child that is learn how to share, things like that. And so these are things that start pre-birth, right, with mom feeling healthy and feeling supported. That's why we're focusing on perinatal support. Our perspective is the earlier the better, and the science bears that out. Brain development in the first 2 years is about 80% of the architecture of the brain. And so everything that happens to that infant, from the language they're hearing, the stress or lack of stress in the environment, all of those things contribute to that child's readiness for kindergarten. And that's why we have this very diverse range of investments, not just preschool quality childcare, but also supporting parents in the perinatal stage to make sure if they're having anxiety, depression, that they have the support they need, so that they can cope well and provide the right kind of nurturing and care for their child. So the answer to that is everything in the strategic plan, right, is intended to support school readiness.
Another question. It sounds like there are a lot of commissioners and community advisors. How do they work together?
So we have, a cadence of meetings for the Community Advisory Council. They meet monthly. We have a cadence of meetings for the commission. They also meet monthly. Those are both public meetings. They're subject to Brown Act. The public is welcome and shows up and provides public comment to the CAC and to the commission. The CAC members often attend the commission meetings and vice versa. And then the staff really, I would say, performs most of the function of making sure that all of the recommendations from the CAC are brought to the commission in detail and laid out. And then also through, we also have a strategic planning committee that met monthly during 2025 to actually build out that 5-year plan. So, it's a series of monthly meetings and then constant communication in between the various groups that have slightly different focus. And then it's staff's job to make sure that we're connecting those dots for everyone.
And have the commissioners given you any recommendations that kind of surprised you or that was out of context?
Um, That's a good question. No, I wouldn't say surprised me. I mean, I feel like our commission is they're pretty aligned. They're pretty aligned with the recommendations, all the recommendations that came from the community, both the Community Advisory Council and the recommendations that we heard when we did, a whole series of focus groups and listening sessions with parents and childcare providers. When we bring those recommendations to the commission, they take them very seriously. I mean, it's in the Prop 10 statute as well as the Measure I ordinance that this work is community informed. So, the commission, yeah, I mean, I've been in this job for 10 years, and my overall impression is that they highly, highly value how essential it is to listen to the community and center the community needs in the design of the strategies.
And I think you mentioned about how they were assigned or put on the commission, but if someone wanted to be more involved with that, how would they go about doing that?
With the commission?
Yes.
Oh, absolutely. Please come to commission meetings. Again, they're public meetings. You can observe them on Zoom, but you can't offer public comment. If you wanted to speak to the commission, you would need to be in the meeting in person. That's the best way. I mean, for the commissioners themselves, the appointment, I can say a little bit about how both the Community Advisory Council and the commission, they are appointed by the Board of Supervisors, but we have a great relationship with the board. They allow the commission and the staff to do a full, recruitment, interview, vetting of community members that are interested in stepping up to those roles. And we make recommendations. The commission makes recommendations to the Board of Supervisors to appoint those folks. So that's been really great because we have been able to make sure that folks are aligned with our values around equity, around racial equity, and the importance of the first 5 years, that we're getting people on the commission and the Community Advisory Council that really do understand these things and are leading from that perspective.
People have asked for you to stop screen sharing so we can see your face a little
Oh,
bit.
of course.
What are the administrative costs and how is that decided when you put together something like this?
Sure. So the commission since 1998, when the Prop 10 was passed, we've had a policy in place that we have a 15% administrative cap. So that means all of Prop 10 dollars have gone out. Everything after 15%. The commission has never exceeded that cap. Now with the Measure I revenue coming in, we're maintaining that same 15% cap, but because of the scale of that funding, it's actually right now our administrative expenditures are well below, like 11, 12%. I expect that to continue and maybe even lower because we've had a little more administrative expenditure this year just because of relocation and expanding our staff. But I would say because of the scale of the revenue, right, up over $30 million a year, there aren't administrative costs that would get anywhere near to 15%. So, yeah.
Could you speak a little bit more about what the services you're providing to the immigrant community and undocumented?
Sure. We are funding, well, let me back up a little bit. In early 2025, we funded a 8-session training of trainers for what's called family preparedness planning. There's a national best practice around supporting immigrant families to plan for the eventuality of detainment or deportation. So we trained 50 individuals from over 25 organizations in the community, mostly community-based organizations that work with children and families. We trained them to use this template to talk to families about their rights. So in the kind of the standard Know Your Rights presentation. And then they went and trained the folks in their organizations. And so now there are at least the 8 family resource centers that we fund are doing this family preparedness planning as part of the overall services that they provide to families with young children. And then in addition to that, we also funded, I think maybe July last year, legal services. So we fund VITAS to do actual legal representation for families that are experiencing a threat to their ability to stay here in the United States because of immigration status, and are targeting those services specifically to undocumented pregnant people, as well as families with young children who either parent both or one parent is undocumented. We're also funding Sonoma County Legal Aid to provide, if a parent opts to name a guardian. So having a actual legal arrangement that there's a guardian here in the United States that would take their child or children in that case. Not all parents are comfortable with setting that up, but it is an option for families to do that. And so that's why we're funding them. And then they're all working together to establish good referral and linkage pathways that are secure, that feel safe to families, sharing information in a way that feels safe to families. And so working with the family resource centers was a really important part of that, because that's where a lot of families will go when they have, urgent needs.
Because this is all state money, it's nothing to do with federal money. There's no
That's right.
issue with that. So that,
That's
okay.
right.
Great.
That's right.
Well, other words of wisdom you have for us, Angie?
I mean, whenever I talk about Measure I always, just want to express how grateful I am to the voters of Sonoma County for recognizing how important this is, how we as a community, like, no one's coming to save us. This is just another aspect of how important it is to be empowered and take kind of the bull by the horns at the local level. Because this will be a game-changing investment in children and families. We will start seeing significant impacts. So just always, and so much appreciation to the voters for recognizing that. And then just another word about, you had mentioned, Donna, a communications campaign to share impacts. There is a piece of our administrative investment is in evaluation. So we will be evaluating both the short-term outcomes and longer-term impacts of these investments. And there'll be a community report on an annual basis that will be available on our website, and that will, be continuing to do kind of presentations like this. Happy to come back anytime and share information with the league on what's going on and what the impacts that we're seeing.
Well, we really appreciate your time today, so thank you very much.
You're so welcome.
We have a couple of announcements. We are getting ready for our candidate forums, and this Friday at noon, we'll be going through a training. So even if you're not sure you can help with the training, this is a great opportunity for you to just observe what happens and to see if you could take part of that. You can get the information on our website. The candidate forums are for District 2 and 4 coming up, so they're pretty important supervisory districts, and we can use your help. So again, more information on the website if you'd like to volunteer. And we will meet again in April, but we don't have a topic yet, so stay tuned for further information about that. And I think that's it. We will sign off for this time. Thank you all.
Thank you.
Thank you, Andrew. It was great.
Thanks.